well, how do they help? What about what they're doing improves the outcome? And we think that it's important to know that families do so much to help with recovery and resilience. They're often they're often have are in a position where they might be living with the person or have a lot of contact, and they're the ones who are going to be encouraging the person to go to a treatment appointment. They're the ones who might even be giving them a ride to treatment. They're the ones who can help reduce the stress that the young person is under. They're the ones who can encourage goals in the moment. If someone's goal is to go back to school and they're hesitating one morning saying, I don't know, it's raining outside and I'm not feeling it today. Yeah, it might be the families who say, I know how important you've told me going to school is. And would it help if I gave you a ride? Because I just know how important this is. They're the ones who can praise progress daily. When someone comes in to see us at the coordinated specialty care team, we see them maybe a few times a week. Well, the families are right there on the spot to provide encouragement. The client doesn't have to wait for a couple of days to get that kind of encouragement. Families are also in a position to discourage the use of alcohol and drugs. In some cases, alcohol and drugs have been the cause of relapse. And we know that families, again, they're there in the moment. And they're there to support the person having a healthy lifestyle. Families are there to see if there's early signs of relapse. If they know what to look for, they can see some of the early indications that a person is starting to have a return of symptoms. And the sooner we know about that on the coordinated specialty care team, the more we can take action. So that's another way that families are helpful. And then finally is that they're there to convey hope to the young person. They can carry the hope. And what we're going to talk about a little bit later is how we help the family feel the hope. And then the family also spreads that hope to the young person. That there's possibility for a rich and rewarding life. And if that's what the family's conveying, that's what the client is going to be receiving on a daily basis.